Hi, I'm Dr. John Neustadt, President and founder of Nutritional Biochemistry Incorporated, NBI, and I'm going to be talking to you today about something that's been in the news a lot lately and that's affecting thousands and thousands and thousands of people, and that's the flu. This year's flu strain is particularly virulent. It's strong. It is affecting a lot of people, knocking them down in bed with symptoms that are just uncomfortable and painful and unfortunately are killing people. The people who are most susceptible to the flu in terms of the risk of dying are the elderly, and that's typically the case with any flu in any given year. And children, young children are also quite susceptible. What's different this year is there's a strain of flu going around that we haven't seen in maybe ever. It's called the H3N2 strain of flu, and the flu vaccine is only about 10% effective against that strain of flu. Whether or not you should get the flu vaccine is a great conversation to have with your healthcare provider. What I'm here to talk to you about is, what do you do if you get the flu? Now, I have a wife, I have 2 kids. What do I do? It's always a great idea to ask whether it's your doctor or your financial advisor, whoever you're seeking advice from, an attorney, what do they do? Where does your financial advisor put their money? What does your physician do for their family? Well, I'm going to tell you today what this doctor does for my family. First of all, what I recognize is that the flu is usually not deadly. What we want to look out for, and what I look out for, are the signs and the symptoms that can lead me to believe that there is a bigger problem going on. But I've never, fortunately, gotten to that phase because I've been able to manage it with my family and myself in a way that is effective at minimizing the duration and the severity of the symptoms, getting my family healthier faster, and that's what I want to share with you today. What we want to do is recognize the body's own mechanisms for fighting infections, and we want to work with those. We don't want to suppress those because that could actually keep somebody from getting better faster. So the first thing that I do is I make sure that it probably is the flu. Now, the only way to be definitive about it is to send a sample to a lab and get it tested and see if it's the flu. Get a lab test done. Well, given that it's the time of year that it's going around, if we have the symptoms of the flu, fever, sweats, feeling achy all over, those are typical symptoms of the flu. I'm going to assume that it's the flu. What I want to look first for is a fever. Does someone in my family have a fever? Now, the fever is the body's mechanism for boosting the immune system. So I don't want to give a fever-suppressing medication to my family, like Tylenol, for example, unless I absolutely have to, unless it reaches a dangerous level. I just let that sucker cook. Fevers are not dangerous in and of themselves. It's actually the body's mechanism for fighting the infection. So typically for me, what I do, and your situation may be different, I recommend you discuss this all with your healthcare provider first, but I will let a fever go in my children this is not for infants. My children are older, and my wife doesn't have any dangerous, what are called comorbidities or other healthcare issues that may complicate things. I'm talking about generally, for the general population, which my family fits into pretty well. I'll let a fever get up to about 102, 103 before I will actually think about suppressing the fever. The only time that I will suppress it, even when it's in a safe level, is at nighttime if they're uncomfortable and they have a fever and they're having a hard time sleeping. Sleep is so important, as I hope you all know, to boosting the immune system, from healing from infections, and from healing in general, and optimizing our health. And so if my son or my daughter or my wife are uncomfortable because they feel achy and they have a fever and they can't sleep at night, that's when I'll give them a little bit of medicine such as Tylenol at an appropriate dose for them, decrease their discomfort, and get them to sleep. The second thing I will do is I will go to my kitchen and I'll go look for good old home remedies that I know work, that are tried and true. They've stood the test of time, and they definitely work for me and my family. And the first thing that I will grab is a carton of chicken broth. And I will empty this chicken broth, the whole thing, in a pot, and I will grab an onion, and I will grab a clove of garlic, a bulb of garlic, actually. I will chop up this entire onion, really small, and I will take about 8 to 10 cloves of garlic, and I will chop it really small, and I will steep it on low temperature in this entire carton of chicken broth. Over a low heat, I will let that just cook slowly and pull out all of those rich phytochemicals, those nutrient-dense the nutrients that are in those nutrient-dense foods of onion and garlic that have infection-fighting properties and immune-boosting properties. I will just let it infuse into that chicken broth for hours. And just let it sit over the stove. And as it warms up, and I will take cups and I will then give that to my family and just sip it throughout the day as much as they can. Now for me, I love a little heat, so I'll go for the cayenne pepper. And I'll put cayenne pepper in the chicken broth as well. Their immune boosting, their infection fighting properties in cayenne pepper, which are phenomenal. It can also increase and boost your metabolism as well. Now you may see out there on the internet, you can do a shot of lemon juice with cayenne pepper and pressed garlic. All of those combinations are basically combinations of very similar things that I'm talking about. The beautiful things with natural foods and using those to boost your immune system and using those to fight infections is that there are a lot of different ways that you can implement them. What's comfortable for you is the best way. The point is to get these nutrients in you. Dietary supplements are another phenomenal way, and you want to look for things that have great research on them. So Sambucus nigra, also called elderberry, is a phenomenal plant, and the elderberry extract has been shown in clinical trials to reduce the severity and the duration of the flu. I can't say enough great things about it, but what you have to be cautious of is that you're taking the right amount. So the clinical trials actually gave 60 milliliters of the liquid extract. And most of these dietary supplements, they actually recommend them on the bottle less. So for this, for example, for me, I'll do a tablespoon, which is 15 milliliters, 4 times a day to get my 60 milliliters in. And it's not toxic, so I'll give the same to my children or my wife if they can handle it. They also come in, you can find them that are in little tablets, chewable tablets. My kids love it, just like candy. And it shouldn't be surprising to anybody if you think about medicines and where so many of our medicines have been derived from. A lot of our medicines come from natural products, come from nature. Lisinopril, the anti-hypertension, high blood pressure medicine, actually comes from the venom of a viper snake. Cholesterol-lowering medication, Lipitor, comes from red yeast rice. Heart medication, digoxin, comes from the plant digitalis. The antibiotic penicillin comes from a mold. So on and on and on, the list goes on and on. So it shouldn't be surprising that nature has a lot of remedies that we can use to boost our immune system, directly kill viruses and infections, and help our bodies heal quicker when we do get hit with the flu. One thing that's important is preventing the flu. Obviously, wash your hands, stay clear of people who have it. But if you do get it, these are phenomenal ways in which you can get over it faster. One other point, a lot of people will come in, they come into my office when I was in clinical practice with symptoms of the flu, and they ask for an antibiotic. Antibiotics are for killing bacteria. The flu is caused by a virus. Antibiotics won't do anything for a viral infection. But if you get better from a flu, and then it relapses and you get worse again, that very well could be a secondary bacterial infection that can develop. So you want to make sure that you reach out to your healthcare provider, or you also have health insurance companies a lot of them have 800 numbers that people can call now to talk to a nurse. Whoever it is that you reach out to as a healthcare professional, if you have any questions about a fever and if it's safe for you and your children and letting it ride instead of suppressing it, and what are the safe parameters and when you should seek medical attention, I do encourage you to speak with your healthcare provider. But these are the things that I do for myself and my family that work time and time again. We just got over a bout of the flu a week ago with my wife, a couple weeks ago with one of my kids. This is exactly what I did. It works like a charm. I think it'll help you too. So give it a try and let me know how it goes. Head on over to NBIHealth.com, our website. We have a lot of free resources, great information. There's a blog on there about natural approaches to the cold and flu that will expand on some of these topics. A lot of other great health information to help you improve your health and the health of your family and loved ones. I will be back here next week. I hope you have a fantastic week, and I will see you next week. Bye.